Dead mid 707, yeah, he breaking it down. From the block to the docks, ultrasound is his crown. Anatomy lessons, straight facts, no cap.
Oh my, this is my bread and butter. This is what I love. This is what I live for. Listen up. Here's the liver, right? Here is the gallbladder. Here's the stomach. And here is, hiding over there is pancreas, right? So when we eat, our stomach breaking down the food, and then it slowly push it here to duodenum, right? And right here we have this axis for pancreatic duct and bile duct, deliver bile and enzymes and pancreatic juice of enzymes to mix with the food so it can be absorbed and digested in intestines. What can happen? Well, see the gallbladder here, it collects bile that actually produced by the liver. Liver produced bile go through hepatic duct into cystic duct into gallbladder. When we have some kind of fatty food and our receptors in our body give a signal like, hey, there's some fat food here we need to digest, gallbladder get signal and it squeeze, like pushes all those bile into common bile duct, and then it's getting to mix with all the food that we ate and help all the lipids, all the fatty food get digested. Now, similar for the pancreas in the matter that it does eject enzymes and pancreatic juices to help digest the food, but it doesn't store it. It produces it, okay? So what can go wrong? Well, let me get this picture. Oh, look how pretty it is. If somebody have a gallstone, it can block gallbladder neck, it can block common bile duct, it can block this area of bile duct and put some pressure on pancreatic duct. This is all results in a lot of pain in epigastric region or right upper quadrant, especially after somebody just ate. And because nothing else going through, it's going to cause inflammation. The obstruction, usual obstruction that we can find with imaging results in inflammation of the biliary tree of the biliary system, and it's also can cause inflammation of pancreas if it's blocking the pancreatic duct right here. The symptoms, people usually come in because they ate and now they have pain in this area, okay, more to the right. Now this pain might mimic heart attack cells. They usually get the heart check too, but usually pain is really sharp, and after they don't eat for some time and take some anti-inflammatory medication, sometimes if it's too bad they give them morphine or Dilaudid, depends on the doctor's decision, okay? It was multiple times when people come in and I would find gallbladder full of stones or just one stone that somewhere stuck in a bile duct and causing all kind of inflammation, which is called cholecystitis. They call it acute cholecystitis. If it's really bad, then gallbladder wall is thickened and gallbladder is distended, and that might be a render for a surgery for cholecystectomy. And don't sweat too much about the terminology, because it's as you just need to learn the basic. Ectomy means something being cut out, all right? So if there's a cholecystectomy, well, chole is a word for the bile, and gallbladder collecting bile. So when they say cholecystectomy, cyst is the word for a bag, right? So this cholecystectomy is mean cut out the bag with bile. Titis usually stands for inflammation. So cholecystitis, inflammation of gallbladder, right? Pancreatitis, inflammation of the pancreas. Yeah, I hope it was helpful. I'll try to cover it more in depth because I do love this topic. This is my gem right here. Yeah. Thank you again. Hopefully it was helpful.
Here I come.